Every year, healthcare data breaches expose millions of patient records. Regulators ask one question afterward: could this have been prevented? For hundreds of healthcare, fintech, and SaaS companies, the answer to proving yes is one framework: HITRUST. By the end of this video, you'll understand HITRUST well enough to walk into a GRC, security, or compliance interview and answer anything. HITRUST stands for the Health Information Trust Alliance. HITRUST, the organization, owns and maintains the CSF, the Common Security Framework, and runs the certification program. One HITRUST control can simultaneously satisfy HIPAA, NIST 800-53, ISO 27001, and PCI DSS requirements. Assess once, report to many. The CSF has a strict hierarchy, 19 control categories, each containing control objectives, each broken into control references, each with granular implementation requirement statements tailored across levels 1, 2, and 3 based on your organization's actual risk factors, size, regulatory exposure, and data volume. E1 covers around 44 foundational controls with 1-year validation, fast and entry level. I1 covers about 182 controls at moderate assurance. R2 is the gold standard, hundreds of risk-tailored controls, full maturity scoring, and 2-year validation with an interim assessment. Choose I1 when you need credible assurance quickly without the full R2 timeline. For R2 assessments, HITRUST scores each control across 5 maturity levels borrowed from NIST's PRISMA model: policy, procedure, implemented, measured, and managed. A control isn't compliant just because a policy exists on paper. HITRUST wants to see it operating in real time, with logs, dashboards, and management review closing the loop. A hospital client tells Medflow, a cloud SaaS platform storing EPHI, "Get HITRUST R2 certified before we sign." An external assessor firm runs a readiness assessment first, a rehearsal that flags gaps before anything is official. Medflow logs into MyCSF, HITRUST's official assessment platform, and defines scope, which systems, data flows, business units, and third parties are in scope. The tool auto-tailors the control set based on organizational size, regulatory factors, and system risk. For every control, Medflow supplies evidence, system-generated logs, configuration screenshots with timestamps, SIEM alert exports, access provisioning tickets, and encryption key rotation logs. The rule assessors repeat constantly: if it isn't logged, it didn't happen. The assessor finds Medflow's privileged access reviews only happen 2 of the last 4 required quarters. This becomes a finding, not an automatic failure. Medflow submits a corrective action plan: what will be fixed, who owns it, and by when. The assessor's report is submitted to HITRUST itself, which performs an independent quality assurance review of evidence sufficiency and scoring accuracy before anything is certified, a second layer of scrutiny most self-attested frameworks don't have. An R2 certification is valid for 2 years, but HITRUST requires an interim assessment at the 1-year mark to confirm controls are still operating. Miss that deadline, and certification status can be suspended. Each HITRUST control ties back to specific citations across regulations. This is called authoritative source mapping. Passing a control with HIPAA in its source list provides documented evidence of HIPAA safeguard alignment. But HITRUST certification is not a legal HIPAA certification. HHS doesn't endorse any third-party HIPAA certification program. 3 distinct players. HITRUST Alliance owns the framework and performs the final QA review. Authorized external assessor organizations, licensed firms perform the field work. Individual assessors holding the CCSFP credential, certified CSF practitioner, do the interviews and testing inside those firms. Covered entities like hospitals and health plans. Business associates handling FI on their behalf. Cloud and SaaS platforms, ER systems, telehealth apps, patient portals, digital health and wearable apps. And increasingly, fintech and other sectors outside healthcare adopting HITRUST for its rigor. Build a security or audit foundation 3 to 5+ years, often with CSP, CISA, or CISM. Join a HITRUST authorized external assessor firm. You generally can't credential independently. Complete HITRUST Academy training, pass the CCSFP exam, shadow live engagements, then lead your own maintaining continuing education as the CSF is updated. MyCSF is HITRUST's assessment platform. A control requirement statement is the granular testable line item. CAP is a corrective action plan. A bridge letter covers a timing gap between cycles. Inheritance means reusing a cloud provider's already validated control instead of retesting it yourself. A control has a policy but no production enforcement evidence that stuck at policy, maybe procedure, never implemented. A client wants HITRUST in 6 weeks. Recommend E1, since our 2 timelines can't be compressed without breaking evidence integrity. And no, HITRUST certification is not the same as being legally HIPAA certified. There's no such government seal. That's HITRUST end-to-end, the framework structure, the assessment tiers, a real-time certification journey, who's allowed to audit it, and the exact vocabulary interviewers expect fluently. Subscribe for more compliance deep dives, and drop your toughest HITRUST question in the comments.